Yes, Rakhil, you can start now.
Okay, sir, I'm going to start now, sir.
Yeah.
Sir, I am a reception nurse, and the daughter present with his father, who is going to be dialyzed. Okay,
Yeah, carry on.
okay, sir. Hello, good afternoon. I am the receptionist nurse. My name is Rakhil. How may I help you?
Yeah, nurse, I came here regarding my father. He's 81 years old. His name is Abraham Lincoln, and I am his daughter.
Okay, so may I know that what is the reason why you are here with your father?
Yeah. I came to know about a dialysis or something which was ordered for my father, and I want to know what is this dialysis. I don't know anything about dialysis. I like to have some detailed information about my father's condition. What does kidney failure really mean?
Okay, so before the doctor suggests you for the dialysis, they already did some investigations for your father, like his urine is not coming, no, he is not passing urine properly, right? And there is a difficulty in the passing urine, and the kidney function is not properly, right?
Yeah.
Is doctor suggest you or explain you anything regarding this?
Yeah, doctor told me to talk to you and you will explain me everything. So I would like to know more about what is involved in dialysis. What is it exactly and why does my father have to come 3 times weekly?
Okay, so let me explain you for you what is the dialysis and why it is required, and why it is required 3 times in a week. Okay, so first of all, I want to know that like the dialysis is required for those patients, their kidneys are not working properly and they required some filtration through the dialysis, right? And
Yes, nurse.
the requirement for the 3 weeks in a week, because the doctor schedule 3 weeks for in a week because your father kidneys are not working properly, so they need 3 times dialysis in a week. So with the 3 time dialysis, until the kidney function is not regulate, you have to bring your father 3 times in a week for the dialysis. Okay, the function of the dialysis is this: it's filter the waste and the excess fluid and clean toxin from your blood, and returning the filtered nutrient rich blood to your bloodstreams. Do you understand that? That normally the kidney, the what the kidney is functioning, that function is not working properly and normally. So for the help of that function, we are using the dialyzer machine. Okay. Do
Okay,
you
nurse.
understand that, or you
And
need more
will this
clarification?
will this dialysis improve my father's current medical condition?
Yes, it will help out his current medical condition, because after the dialysis, his blood pressure will be in the normal range, and he is diabetic. He is hypertensive and diabetic as well. And with the clean blood and blood, when the clean blood is circulating in his body function is a normal. And if there is any hindrance, or if the blood is not cleaning properly, and if the blood is not cleaned in the body, so his blood pressure will be raised and his body will be more facing difficulties. And for that purpose, the dialysis is required. And before the dialysis will start, we will explain you the procedure. We need to pass the catheter, like there is a 4 or 5 basic sites where we are passing the catheter, and through that catheter we are doing the dialysis. Okay, so before, do you understand that what I'm explaining you?
Yes, of course, nurse. And will this dialysis treatment be painful? And will there be any side effects?
There is no any side effect, even though it will be a helpful for the patient, and for it's a non-invasive procedure. Okay, so they will create a anterior venous AV fistula. Okay, and through that fistula, they will do the dialysis every time whenever he will come. They are not punching every time new site, like normally they are giving the IV medications or any medication through the injectable. It's not the procedure like that. Once they will create the fistula, through that fistula, every time they are doing the dialysis, okay, until that fistula will work properly.
Okay, nurse.
Uh, Okay.
My father is 81 years old. What could happen
Okay.
if he were to decide not to continue his treatment?
If he will decide not to continue his treatment, that the other option is that you will find, or we are going to that stage where he need to do the kidney transplantation, because after that, if he is not willing to do the dialysis, then that is the only option after that. Okay. And for that thing is very difficult, it is very costly, and also it is very difficult to find a donor who donate the kidney. If it is possible within your family member, that is very good, and if any of the family member is agree, that is also very good. But if it is not possible, then only the option is dialysis. We need to do his like his therapies, like kind that, like you have to motivate him, like it is very essential for him until he needs to require the dialysis, he need to do that. Okay. Because if he will not do, his condition will be more worse. He will have more medical problems, and with that medical problem, it is difficult for him to survive like in this kind of conditions. So for that, we need to do his counseling, like why it is essential for him and why he need to do this regularly as per the doctor advice. Uh, do you understand, or you need further like explanation? I think that it's this information is enough for you, and we are going to start the procedure.
Yeah, that's very nice, nurse. You have explained very clearly. That's good information. Thank you.
And one more essential thing is that before starting this procedure, we need to sign the consent form, which is a written consent, and that consent is signed by you or any of the family member. Okay. So after signing that consent form, we need to start the procedure. Uh, is that okay for you?
Yeah, fine, nurse.
Shall we move on the procedure?
Yeah, we'll do it. Thank you very much. I'm ready to sign the consent.
Okay, thank you very much.
Okay, right. Now, coming to the point. Uh, yes. So, hello. That is how you began the session. Hello is an informal greeting, not a formal greeting. So avoid
Okay, sir.
hello and hi and other things. And then
Okay,
next
sir.
one is, yeah, you can mute the audio speaker. So you
Okay,
are
sir.
going to get the feedback now, so you can listen with attention. So hello is an informal presentation. It's for friends and some relatives, or in general setting, you can use hello, hi, like that. But in a formal setting, it's always greet with good morning or good afternoon or good evening or good day, something like that. Then avoid repetition. You're repeating some words again, time and again. So avoid repetition. And you said that there is a 4 or 5 sites. 4 or 5 is not singular, it's plural. So you cannot say a, number one. And you have to say there are 4 or 5 sites. So there are 4 or 5 sites, not there is a. So that's a mistake. And you have pauses and breaks. 1 or 2 places you just got stuck. You did not know what to speak, and you got stuck, and you got an idea after 2 3 seconds or 4 or 5 seconds. Then you continued. So that's a drawback. So you should be ready with. Okay, you should not speak very fast. So it's better a little slower but steady. The next one. If he will not do, if he will not do, his condition will be more worse. So there are two mistakes in this. There are two mistakes. So whenever the if condition is there, the first will be vanished. If he does not undergo dialysis, you should be very clear. If he will not do, what do you mean by if he will not do? What? If he doesn't undergo dialysis, if he doesn't, so it should be simple present tense. With if, it should be simple present tense, and the other part there should be will. So if he does not undergo dialysis, his condition will be worse. You said more worse. More worse. Worse is already comparative degree. Bad. Now his condition is bad. His condition will be worse. Bad to worse. So you should not say more worse. With worse, bad past comparative degree is worse. For example, if it is beautiful, more beautiful, hardworking, more hardworking, industrious, more industrious, but bad, it is worse. No need bad worse. Okay, more worse is wrong. So never use more with worse, because worse is already a comparative degree. Remember that. Bad, worse, worst, good, better, best. You cannot say more better. No, good, better. Better itself means more good. You understand? So you cannot use more good. Then next one, more is already there in that. Next you said any of the family member. Any of the family member. How can it be member? It should be members. He has many members, family members, and one of them, any of them. Okay, any of them, not any of one. So you are using a wrong phrase here. Any of the family members. Any means anyone. Anyone of the family members. That means you cannot say member here, because it should be members. There are many family members, one of them, not one of one. So this is another mistake. So you have grammatical errors which are very very which will be scrutinized, and you'll be punished for that. You will get less marks for these, because these are concepts. Remember that. So learn these concepts, whatever I have told you, and make sure that these will not be repeated in the next sessions. Yeah. So the audio is already there in the YouTube. You can just type your name and say kidney failure, then automatically you'll get it. I have already put it on the YouTube. You can just check it out. Go to my grandmaster class. Then you just type your name, Rakhil and kidney. Enough. 2 words. Your name and kidney. Because Rakhil might have many speaking sessions, and many people might have done kidneys failure speaking sessions. So your one name and one problem. So Rakhil kidney, you just type, and you'll get that one. I'll show you how. Yeah, you have to just go to YouTube. Okay, then you have to just go to YouTube. Just go to YouTube, and then you type your name, Rakhil and kidney, YouTube. Okay, Rakhil and kidney, that's enough. So yeah, kidney failure, Rakhil Barkhat. See, it is here. Kidney failure, Rakhil Barkhat. Just click on that one and you'll get your video. It is live now, actually. Okay, you can just go through that one and you can get everything. So no need to worry at all. No need to worry at all. So here you see kidney failure, Rakhil Barkhat. Just click on that one. Just type Rakhil and kidney. If you write Rakhil Barkhat, then all your speakings and all your writings will come. So just to get that one straight away, you can get here. That's it. So now coming to the point, Rakhil. Yeah, you can unmute, Rakhil.
Yes, sir.
Yeah, you got the point. How to find out your audio?
Sir, I'm searching that.
Yeah, you can get it directly. Okay. Otherwise, I'll send you the link. No problem. Right. Okay. That's fine. Do you have any requests or anything? You can ask me now.
No any request, sir. Like with this much mistake, as you point out that I have,
These many mistakes. These
yeah,
many
these
mistakes.
many
Not this
mistakes.
much.
So
Mistakes are
what?
countable. Mistakes are
Okay, sir.
countable. Hmm.
Okay, sir.
Yeah.
Sir, can you please tell me what will be my score?
For this one, your score will be 330, 320, 330, 340. If your luck permits, 350. So you are borderline, a borderline. Okay,
Okay,
fine.
sir.
You are not doing too many mistakes. You will not get C, but definitely C plus, but higher side of C plus and close to B. So you're close to B. Definitely, if you improve these conditions, you will be close to B plus. Okay, if you
Yes,
do
sir.
not do
Yes, sir.
mistakes, you will be close to B plus. 50 marks, you'll improve. If you From 330, you can add 50 marks. So it will go to 370, like that.
If I will not
If
repeat these
I
mistakes.
just now told you, with if you will not use will. If I do not do mistakes, if I avoid mistakes, I will get good scores. Second part
Okay, sir.
will come. With the first part, with if no will. If I avoid mistakes, I will get good scores. You are saying if I will avoid. Why will? In if two wills will not be there in one sentence, only
Okay,
one will.
sir.
Okay, in the second half will be there. In the first half, if itself is enough. Got it?
Okay, sir. Okay,
Okay,
sir.
right. So next,
Sir,
yeah,
I have a letter for the correction.
yeah.
So
Just give me
when
some time. Just to give me some